So yeah, if there's no questions, I guess yeah. So do check out Collective Minds Radiology. As you can tell, they are brilliant. Really, they are. So is the can appendicitis cause pyelonephritis? Unlikely. I don't see how that could really happen because the the ureters are so far away from the appendix. And remember, this is bilateral, right? We'll have a look at that actually. Myeloma case, we'll go to that. Yeah, fine. So it would be unlikely. Sorry, my doorbell does this like Halloween thing, so I'm really sorry if you can hear that. But it would be unlikely that you'd get appendicitis, which hasn't inflamed that much, burst or has no collection or anything that would cause bilateral, bilateral ureteric enhancement like that. So I don't think they're entirely related. But you have dual pathology. Sometimes I've seen things where you've got like appendicitis and a renal stone. It's like, I don't know what caused the pain. Was it the appendicitis or the renal stone? It's both on the right side, but it doesn't mean they're necessarily related. Patients don't come in like textbooks. They sometimes come in with all sorts of weirdness. Some journal cases, yeah, maybe, or Halloween. Maybe, yeah. So someone wanted to go through this case. So what's the question? Is myeloma cause was it dural bulging in the frontal sinus? So look, yeah. Thing is, look, you've got your frontal sinus, and the frontal sinus has got bone, right? And so I don't think this is going to be related to the sinuses. It's not going to be sinus disease. This could be just be destructive bone lesion that has extended. So expansile destructive bone lesion that extended into the sinus. Alternatively, you could actually have the situation. And there's someone saying, is it dura bulging? So the dura, it looks like it's bulging to me. Yeah. Better way to look is by doing an MRI scan if you are concerned. I don't see why anyone would be concerned about the dural bulging, but you would do an MRI scan because when you look at the CSF, it's going to be very, very bright, and you may be actually be able to see that sort of dura flexion, like kind of pushing inwards. On the CT scan, though, if we do zoom in, I think you can see that, yeah, there is definitely an expansile component with some bulging there. The underlying brain looks okay. I can't be 100% about the the CSF space around it, but I would think that looks okay. You can almost see a bit of CSF around it, so it's probably pushing inwards rather than infiltrating at this point. Of course, it could, I suppose, at some point, couldn't it? Cool. Well, I had a lot of people turn up today. So, I mean, going from strength to strength, thank you so much to everyone that turns up. I never said I'm an expert. I just like to do cases, bit of a case geek. I love to share good cases that I get to go through. I learned from you guys as well as much as possible. So if you can, please do fill out that form. Tell us what you think. Tell me what I can improve because I do want to be a better teacher. You may see me on Radioped and all sorts of things. I want to be better. So if you guys can help me, let me know where I could improve. And as always, I do really, really appreciate all of you guys. Do follow me on Twitter, Instagram, YouTube, do all sorts of funny stuff on there as well. And I run courses with radiology seminars as well. So previous lectures will be on the Collective Minds YouTube channel. They are now, as far as I'm aware, and Dan can correct me, but they are start to upload some of the videos straight onto the platform as well. So you may be able to go through previous cases with the video that's already in the platform. So you don't have to go between platforms. You can stay on one platform and go through the teaching that I've done. And we have done a lot now. I don't know what number this is, but we've been doing this for more than a year. So there's an absolute, actually saying there's a wealth of knowledge is probably a bit big-headed. There's a lot of stuff to look at. Let's leave it at that. Okay, cool. Anyway, have a good evening, everyone, and I'll see you on the next one. Bye.